Thank you. I will start with a little bit of Japanese. おはようございます。安倍総理、武見先生、そして日本政府の皆様、本日このような貴重な機会を賜り、深く感謝申し上げます。Thank you. I would continue, but I would be at risk of a brain infarct if I continue to try. Let me start by saying that Prime Minister Abe and the Japanese government's very strong leadership on our shared commitment to universal health coverage has been critical in advancing ideas that Prime Minister Abe has talked about: freedom, fulfillment, and the capabilities of all people, especially the poor and the vulnerable. I'm really encouraged to see so many of you. We're just really a fantastic group of leaders in global health for this conference. I'm also very grateful for Japan's dedication to this issue, because we have to admit that we just have not done well so far on this journey for universal health coverage. At Alma-Ata in 1978, World Health leaders committed to providing health for all by the year 2000, emphasizing the needs of the poorest countries. But we all know that we have fallen far short of those expectations. After Alma-Ata, many organizations, including the World Bank Group, believed this comprehensive approach was too expensive and unfocused. The international community instead turned toward targeted campaigns and initiatives, including very important campaigns to increase childhood vaccinations, for instance, or treating some of the world's most deadly infections, often with extremely positive results. For example, from the 2000 Okinawa G8, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, which has had a transformative impact. Now, during that time, while some developing countries built stronger health systems, many others remain unable to provide basic health services that are critical to people's well-being. Today, the support and commitment for universal health coverage has never had such momentum. Organizations like ours, the World Bank Group, are working with countries to strengthen health systems. Research couldn't be clearer about the benefits of investments in health. The Lancet Commission found that the economic return in developing countries could be as high as 10 to 1. We would not be in this position today without Japan's leadership. In 1961, Japan established universal health coverage, or UHC, a really remarkable achievement for a post-conflict country. Ever since, Japan has shown the world the importance of UHC for peaceful and healthier societies. Excuse me. Japan's advocacy is also a major reason why UHC is included as a target in the Sustainable Development Goals. Japan's also played an important role in the progress we're making on two fundamental challenges to UHC: the affordability of care and access to basic services. 2 years ago, here in Tokyo, and I think in this same room, I announced that the World Bank Group and the World Health Organization would collaborate to pursue two ambitious targets. The first, that no one would fall into poverty because of out-of-pocket healthcare expenses by 2030. And the second, that by 2030, 80% of the population would have access to basic health services. Now, I think these targets will be very difficult to reach, but I'm confident, and more confident and optimistic than ever before, that we will succeed. We and other development partners are already working together in important ways to make progress toward the UHC that will allow us to achieve those goals. The Primary Healthcare Performance Initiative, for example, with the strong support of the Bill and Melinda Gates Foundation, and especially the very strong personal support of Bill personally, will help developing countries track key performance indicators for primary health care, identifying parts of the system that are working well and ones that are not, and then adjust funding mechanisms to incentivize countries to reach these targets. The Global Financing Facility for Every Woman, Every Child will accelerate efforts to end preventable maternal and child deaths by 2030. This country-driven partnership will catalyze greater investments in frontline health services and preparedness by increasing grants and low-cost financing. The facility will also help countries access additional private financing and World Bank loans at very low interest rates. The Global Financing Facility is also very closely linked to IDA, the World Bank Group's Fund for the Poorest Countries, helping to make even more funding available for health system strengthening. IDA is already our largest source of support for health in developing countries, with $4.9 billion in new IDA financing for health in just the last 3 years. Now, leaders from developing countries have told us that IDA financing is one of the most effective sources of donor assistance, and generous contributions to IDA, especially from Japan and other countries, have brought quality basic health services to the world's poorest people and improved their resilience to crises. The international community can also greatly accelerate progress toward universal health coverage by rebuilding our global health architecture, as Kezo spoke about, to ensure faster, more effective response to public health crises. After the H1N1 pandemic, as in past pandemics, we followed a traditional pattern of panicking during the time of the emergency and then neglecting the problem once it had passed. This cycle of panic and neglect is very common, but it's also very deadly. The failure to build strong health systems in Guinea, Liberia, and Sierra Leone led to the world's largest ever Ebola epidemic, as we've heard about. More than 11 million people killed and billions of dollars in losses to some of the fastest growing economies in Africa in these 3 West African states. Now, we all hope that we can mark the end of Ebola in the near future. But we can't forget what happened. We have to prepare for future pandemics now. Experts predict that it's very likely that sometime over the next 30 years, we will face a severe pandemic like the 1918 Spanish flu, which would have the potential to kill as many as 30 million people in 250 days and reduce global GDP by roughly 5%, or close to $4 trillion. The UN High-Level Panel report on Ebola and other expert reviews will help us improve pandemic response and preparedness. And at the request of the G7 and G20, the World Bank Group, the World Health Organization, and other partners are trying to build this comprehensive response. A critical part of the response that we've been working on is called the Pandemic Emergency Financing Facility. The facility aims to eliminate financial constraints for a swift and effective response to an outbreak using pre-arranged public and private financing, including resources from insurance and capital markets. We're hopeful that once it's fully functional, this facility will save lives and protect economies. The financing facility will be an essential piece to a much broader framework for managing pandemic risks. The international community must now increase investments in data reporting, disease surveillance, and outbreak preparedness. We must have a strong and well-funded WHO, and the reforms underway to strengthen its emergency response capacity are a great start. We must fully fund the Contingency Fund for Emergencies, which will complement the Pandemic Emergency Financing Facility. And the review of the international health regulations should result in a permanent shift from a voluntary, subjective, self-reporting assessment process to one that's mandatory, objective, and verifiable. In addition, I believe that we need a new way to hold all of us accountable. We must create a new international mechanism that will be apolitical, technical, and independent of countries, institutions, or funders. It should have the mandate, funding, and authority to evaluate the preparedness and response plans of governments, of international institutions like the World Bank Group, the private sector, civil society, and communities. This group of trusted experts who would tell the unvarnished truth to the highest levels of the global system must be empowered to call for action from the entire pandemic response community. Embracing full transparency and accountability may make us uncomfortable, but it's precisely that discomfort that will put us on the right path to stopping pandemics. You know, when I was young, thanks to my mother's influence, I often read the speeches of the American civil rights and anti-poverty hero, Dr. Martin Luther King. In one of my favorite passages, Dr. King wrote, and I quote, "We are confronted with the fierce urgency of now. In this unfolding conundrum of life and history, there is such a thing as being too late. This is no time for apathy or complacency. This is a time for vigorous and positive action. Japan's G7 presidency and the Ise-Shima Summit next May is our moment for vigorous and positive action. It's our opportunity to finally act on the unfulfilled promise of Alma Ata and move rapidly toward universal health coverage. And in doing so, prepare ourselves before the next pandemic hits. Accomplishing these twin goals will represent a quantum leap forward in people's health and economic well-being. We have no time to waste, and as Dr. King said, we only have the fierce urgency of now. Let's seize this opportunity together. Thank you very much.